Hi, my name's Adrienne. I'm one of the clinical supervisors with Frederick Health Hospice.
And I'm Ann, I'm also a clinical supervisor.
We are doing this presentation today to teach you a little bit about hospice and what we do in the home and how we can work together. We'll start out with what is hospice. Hospice is comfort care for people that are in an advanced stage of a terminal illness. Our goal is to manage symptoms, but also to honor our patient wishes and the family wishes as well. Typically, people have a prognosis of 6 months or less of life to be on hospice services, but there is no true time limit. We have people on service for a couple of days. Some people are on for a couple of years. As long as there's a need for service and a decline, we can keep people on our services. There are many different reasons a person might be on hospice. Some of the most common diagnoses are cancer, dementia, abnormal weight loss, heart failure, COPD, stroke, kidney disease, Parkinson's disease, and ALS. There are also many different other diagnoses as well, but we do review medical records to make sure someone's appropriate for services. Some of the signs that someone's in the final stages of these diseases is frequent falls, frequent infections, trips to the emergency room, difficulty swallowing, decreased appetite, not being able to walk or even do some of the ADLs that they used to do by themselves, weight loss, or wounds that just won't heal. So, if you think someone might be hospice appropriate, one of your clients, definitely reach out to your supervisor. The families can call in for their loved ones. A patient can call in for themselves. A doctor can make a hospice referral or even a community agency if they think a person could benefit from hospice.
So once a patient is on hospice, our main focus is on their quality of life. And each client has access to their RN case manager, and the nurse will come out once a week up to every day if needed. Their goal is symptom management, so it just depends on how much the nurse is needed. Then we also have a social worker who comes once at admission, and then will come as needed if the family or patient needs help finding other resources in the community to help their situation. We also have hospice aides that can come visit. This is obviously will go hand in hand with what you do as caregivers in the home. You can work hand in hand with them, or we can also have our aide kind of supplement when you're not there with the patient. So definitely an extra help for the patient. And we also have chaplain services that will come for spiritual support. They can also be companions and just be able to talk to them about anything they want to talk through at the end of life. We also have volunteers that can do a number of things. They can do come and read to the patient, or they can just be there as a compassionate presence. There's many things that our volunteers can do. We also have pet therapy volunteers, which is always a big hit for those who love different animals. It can be very soothing at end of life. Then we have veteran liaisons who can help any veterans who may need help knowing what other insurance or benefits they might have that they didn't know about. And they also do a nice recognition ceremony for serving our country. And then we also have music therapy as needed. So once a patient is on hospice, they automatically receive the RN visits, the first social worker visit, and then the other disciplines can be optional and as requested. So you want to contact hospice if the client is showing any signs of discomfort or there's a significant change in condition. If the family has questions or is confused about medications, please encourage them to call hospice. We are open 24/7 for symptom management and guidance. So what to expect at the end of life. So these are clients that you've worked with for a long time, and you kind of know their habits, some habits you don't know, but these are things that you want to kind of know ahead of time and watch for. So they will have changes in eating, skin breakdown, pressure ulcers can form very quickly. So you want to focus on turning the patient. Shortness of breath and open mouth breathing. Again, you just want to see if there's any discomfort to let us know. And they can have increased pain, increased agitation and anxiety, and also gurgling at end of life. And these are all things that we can help control the symptoms to keep them comfortable.
So as caregivers in the home, you play a very important role. Just being there provides a sense of support for the patient and the family. Oftentimes they see you several times a week, sometimes for years at a time. So you're just being there as a sense of support for the family. Also for our staff, you are a very important set of eyes and ears. We rely a lot on your information. Sometimes you know better than the family does what is normal for the patient and what is abnormal. So we rely on your information a lot for changes in eating, bowel habits, and anything out of the ordinary that you might be noticing. You can always contact hospice as well if you're there with a client and you're noticing a decline or you have concerns or questions. You certainly can reach out to us as well.
So knowing what to say at end of life. So as Adrienne was just saying, you've known these people for a long time. So these are some common things that you really want to pay attention to, such as do not provide false hope. So because you've been with this patient for a long time, you may have been saying things like, you'll pull through, we'll get you better soon, that kind of thing. So don't provide false hope. So you do want to reassure the family and the patient that they are comfortable. And if they're not, encourage them to call hospice. The other one is do not talk about the client as if they cannot hear you. So we do believe that they can hear us even if they haven't been talking for weeks. So you want to talk through your care. So things like, I'm going to turn you now, or I'm going to clean you up now. And don't talk over the patient and to the family as if the patient's not in the room. This can cause agitation. You also do not want to force food or drink, and this is one of the most challenging things that we deal with. So you want to offer it to them and let the client be the guide. So if you have a patient that is not opening their mouth when you try to feed them, you don't want to force it, but you can provide mouth care, and we can obviously give you guidance about any of this in the situation with the patient that you're in. Do not force the patient to get out of bed. So again, you've been with this patient for a long time and you've had a routine. And one of the routines is to get them out of bed every day, and that was, the goal. So now that they're at end of life, you want to reassure the family that it is okay for the client to stay in bed at end of life, and the goal is for turning them and preventing pressure ulcers. So that's it for now. If you have questions about hospice or about a specific patient that you're working with now, you can reach out to your supervisor, and they can call us, and we will hope to see you again soon.